Back pain, which can often be connected to the spine, is one of the most widespread health problems affecting 4 out of 5 Americans in their lifetime. And non surgical, minimally invasive surgery may be the answer to eliminate chronic back and leg pain. Here to talk with us about minimally invasive spine surgery is Dr. Gurvinder Deal, spine surgeon with Wake Orthopedics. This is Wake Med Voices, a podcast from Wake Med Health and Hospitals. I'm Bill Klaproth. Dr. Deal, thanks for your time. So for someone with chronic back and leg pain, who is a good candidate for minimally invasive spine surgery?
Basically, someone who has had pain for anywhere from 6 weeks to 3 months, who has failed extensive non-operative treatment, including physical therapy, various medications, maybe some injections, and they continue to have pain either in their back or their leg. And an MRI has shown that they have either a pinched nerve or a compressive disc in their spine. Those people are good candidates for minimally invasive spine surgery.
And then what are the different procedures you perform?
What we do is take the pressure off the nerves. The nerves go out of the back and into the legs. And so whether it's a discectomy or what we call a decompression, where we shave away a bone spur to free up the nerves, that's called a decompression or a discectomy. Then if the spine has some instability where one of the bones has moved forwards on the other bone, then we sometimes also do a fusion. And both of those, whether it be a discectomy or a fusion, can both be done minimally invasively.
So then what are the main benefits of minimally invasive surgery? It seems as if this is going to provide quicker recovery, less operating time, those types of things. So really, that is the main benefit over traditional open surgery?
Yes, that's a great question. So I've been doing spine surgery now for almost 20 years. And when I first started, we would do big incisions. We would have more blood loss. People would stay in the hospital for 2 or 3 days. And now what we've been able to do over the last probably 5 to 10 years, we've really evolved the ability to do the same surgery through smaller incisions with less blood loss and essentially less muscle disruption under the skin. So we're less ablative with the surrounding tissues, we're less ablative with the muscles. And so that way, when we do smaller incisions, we have less blood loss, and people a lot of times can either go home the same day or just spend one night in the hospital and go home the next day. And then their recovery is quicker. They typically have less pain, and also they can hopefully get back to work or back to the activities they like quicker than with typical open surgery.
So this does give you the ability to do outpatient spine surgery?
It does, and because we do it through small incisions and we lose less blood, and we can do surgery through these tubes, and we use microscopes, that way, because of the things I mentioned, people can go home the same day. So we can do spine surgery in the outpatient setting, very much like sports medicine and hips and knees and shoulders have gone outpatient for many, many years. We now can do spine surgery outpatient because of essentially less blood, smaller incisions, and less disruption to the surrounding muscles.
So quicker recovery, less pain, and then a faster return to work and activities?
Yes, that's essentially, if you look at our data in regards to minimally invasive surgery, that's kind of panned out, and people do well, and again, don't have to have lengthy hospital stays.
And then what about the long-term prognosis after minimally invasive spine surgery? Do we know of the efficacy of this compared to traditional open surgery?
In the long run, you achieve the same result, which is either to take the pressure off the nerve or to do a fusion. So now the good news is that we can do it less invasively and essentially get the same outcome as an open operation.
Right. So I know you kind of told us at the beginning who is a good candidate. Someone listening to this may think, hey, I'm a good candidate for this. I want that. Are there people that aren't good candidates for minimally invasive spine surgery?
People who have had surgery before, they tend to have more scar tissue, so that can be a little more challenging to do surgery through small tubes or through small, what we call keyhole incisions. And then more complex, what we call deformity, where we're doing bigger reconstructive surgery. Those are typically not candidates for less invasive surgery at this point. But other than that, we have a lot of minimally invasive spine surgery options, both in the low back and the neck. And so most people, believe it or not, tend to be quite good candidates. And obviously, we tailor everything to the individual patient, but most of the time, we do have good options to do less invasive surgery for most people.
And is there anything else we should know about minimally invasive spine surgery?
Is that I think it's come a long way in the last 5 years, and I think spine surgery historically, obviously, when you tell any patient that they need spine surgery or they're looking at spine surgery, it can be quite intimidating. It can be very nerve wracking for someone to go through that kind of surgery. And so I think what we're able to do is take something that historically was very intimidating, a little more uh, anxiety provoking, and say, look, we can do the same operation. We do it through small incisions, and we can even do this in an outpatient center, or you can even go home the next day. And people are quite amazed when we tell them that, because their perception of, I think, spine surgery is often the former what we talked about, and so when we kind of educate them in regards to what can be done, that's the most compelling. And then just seeing these people go home either the same day or the next day, and then they get back to work, they get back to their activities such as sports or playing with their children or whatever they like to do. That's the most compelling thing about what we do, and returning people to uh, the activities they like to do.
Well, the benefits of this are easy to see. Easier procedure, less pain, quicker return to work and activity. So, minimally invasive spine surgery really is a game changer for a lot of people. Dr. Deal, thank you so much for your time. This has really been fascinating.
Yeah, absolutely.
That's Dr. Gervinder Deal, a spine surgeon with Wake Orthopedics. I'm Bill Klaproth with Wake Med Voices, brought to you by Wake Med Health and Hospitals in Raleigh, North Carolina. To learn more about orthopedic services at Wake Med, please visit wakemed.org. And if you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you. This is Wake Med Voices, a podcast from Wake Med Health and Hospitals. I'm Bill Klaproth. Thanks for listening.